to Tea with T Cells. This is Marta.
I am Shafka. Tea with T Cells. For today's Tea Fact, we are looking at a 2024 meta-analysis type study. So if you don't know what a meta-analysis type study is, these are like a study that analyzes findings from multiple different studies and then tries to come to a consensus that all of these studies sort of found together, essentially. So these are quite powerful studies. And today's study was published in Current Developments in Nutrition, where Bandari et al. Found that drinking up to 2 cups of any tea a day, so this is any tea, because the question they asked was just, do you drink tea, can reduce your risk of dying from a heart attack or a stroke by up to 19%. So that's quite a strong case for drinking tea, I suppose. What's really interesting about this study as well is that they also looked at alcohol drinking and also the effect of sugary soft drinks. And what they found was that drinking just 1 serving or more of either alcohol or sugary soft drinks regularly increased your risk of dying from circulatory diseases by up to 30%. Now, what's important to mention here is that the study looks at long-term drinking of tea or alcohol or soft drinks. So you're not going to see these effects if you just have 2 cups of tea for a week or 2 cups of tea for a month. I think for the tea, they looked at 11 years. For alcohol and soft drinks, they looked at even longer periods of time. So this is a regular thing. Obviously, these studies will also have their weaknesses, but for that, we'll have to look at an entire podcast. So we'll leave it there, and we hope you enjoy this podcast. I would like to give you an introduction because actually I think especially our listener base would be really interested in your history. So today we have medical doctor, Dr. Suleman Sabir, who started his journey in science. So he did some science degrees at the beginning of his career, and then he transitioned into medicine, which a lot of our students are either aspiring to for their whole lives or somehow managed to get into at some stage. So you'd be really interested to know about Suleman's story. So Suleman, welcome to our podcast.
Thank you. Thanks for having me.
So let's start off by talking about, we almost talk to everyone about this, like what sparks your interest in science? Because obviously you started your journey in science. So how did it start? What sparked your first interest?
I think I was just a very curious child from a very young age. I was just always very curious about the world around me. And like Shafka, I've known each other for many, many years, and I've probably spoke about a lot of this, but I used to be a very playing in the garden type kid, and weirdly, whenever my goldfish used to pass away, I used to dissect them, which was really kind of creepy, but I used to be fascinated by it.
What tools did you use to dissect your goldfish?
I think it's just kitchen utensils. It was just knives and forks.
Sounds a little bit creepy.
Yeah, I don't know what that says about me, but I used to be fascinated about the world around me, and I used to just think about a lot of things. I always just think to myself, why are things happening, and a lot of curiosity. And I grew up around University of Glasgow, so I was always around the Hunterian Museum in Glasgow, and I was always around the Anatomy Museum in Glasgow. And I remember as a kid going to the Hunterian Museum and seeing massive dinosaurs and seeing things, and I used to go to summer schools and stuff, and it was just amazing. I found it really, really fascinating. And I think it was from that very young age that I kind of captured by the world around me. And at that point, I wasn't too sure that it was kind of the biological sciences or medicine that was interesting. I just knew I had a curiosity about everything around me. And yeah, I think that's what drove it really initially.
So it started really early.
Yeah, it did. It really did start very, very early. Very, very, very curious child. I always wanted to know what was going on around me. Some people would say nosy.
But it's a good sign, and I think it shows also to always listen to the kids of what they are interested in, because I was very similar in this sense. Maybe I wasn't dissecting fish with the kitchen utensils, because but it was always all these books, all these snails in the garden, where they go. It was always this curiosity, I think, the curiosity-driven passion.
Yeah. And I think if you nurture that as a child, it's that it translates into an adult. You have that passion moving forward.
Absolutely.
If you get it from a very, very young age.
Yeah. I mean, I guess you kind of already touched on my next question, which was, did you always see medicine as your sort of end goal? But you kind of said you weren't really sure at that stage. Yeah.
I think as I got a bit older and I was kind of not even a teenager, I think when I was about 10, 11, I started to like get fascinated by the human body. I used to have encyclopedias and looking at anatomy, and it was anatomy initially. It was really like, oh gosh, I'm really fascinated by how the body works. And I remember seeing pictures of like the kidneys and learning that the kidneys make urine and all this type of stuff. And I thought that was absolutely fascinating. And then having the anatomy museum nearby me, where at that time you could go in as a member of the public and go around and look around. And I remember there's two things that really captured me. I still remember to this day, there was a placenta that had been injected with mercury. And I think the sample's still there. And there was a pair of conjoined twins that had been preserved. And I just thought it was absolutely fascinating. And then I kind of started to open the world of kind of medicine and just getting really fascinated about it.
You should say this to the parliamentarians, because that's literally why they have these museums. You're like the only person who's told me that, like, as a child, these museums really worked to like get me interested.
Yeah, it's weird that you think about it now. You don't really think about these things about yourself, but like it really was. It really did have a big impact on me.
That's fascinating. Was there anything in school, like any subjects in school that did it, or any teachers or anything that inspired you?
In high school, yeah, I loved biology. I mean, I don't know what it's like in the English system, but in Scotland, there was always a big focus on plants, which I found kind of boring. And I was just like, oh gosh, we're learning about xylem, phloem, and all that type of stuff. And yeah, it's interesting, but it gets boring to a certain extent. But I did have one teacher that totally like took me under his wing, Mr. Rowney, who was my biology teacher in high school. Yeah, we would have discussions all the time. I would bring in like newspaper cuttings of stuff that I found and about science, and I'd bring it into him and we'd discuss it in detail, to the extent that he had a little folder for me and he used to keep all of the newspaper cuttings in the folder. And it was just really nice to have a kind of an older mentor that was there to guide you and kind of help mold your interest.
Yeah, it shows how important. I think it's been in this podcast a few times already, like the importance of actually our mentors, which could be obviously our teachers. And yeah, like quite a few people said the same thing, that it was the teacher that actually inspired them, and you just wanted to be like him and just stand basically on the shoulder of the giant. So yeah.
Yeah, I think mentors are really important, but unfortunately, I think it goes both ways as well. So, and I think that's something. I mean, obviously, me and Suleman know each other very well. I don't think I mentioned this, but we actually did our PhDs together. But one of the things that you had in school, you've told me, was there were people that actually doubted your ability, that sort of questioned your ability. So, what was it, and whatever you want to share with us, and then how did you deal with it? How did it affect you? What kept you going in those times?
I don't think in school, I don't think I was actually I don't like to use the word bright or intelligent, because how do you define that? There's very many ways to define that. But I was always kind of seen as the child that was just always trying but not doing much. And I was just like, I was really downtrodden and felt really kind of, oh gosh, that doesn't feel very good. And I always had that kind of motivation in me that I definitely am going to do something. I'm going to make something of myself. And I think it was my own kind of belief in myself to push forward and to get the grades that I wanted, but also like my mum really pushing me as well. My mum pushed me as well quite a lot to believe in myself. So when I didn't get that validation in school, my mum gave it in bucketfuls, where she was just like, you do what you want to do and you do how you feel you want to progress. And she supported me. I didn't get that validation in school, unfortunately.
That's really interesting.
Yeah.
Because also that goes the other way, right, Marta? Like, family can sometimes hold you back as well.
Yes, I think we all know something about it. So what do you say, would you say to students nowadays that have a similar situation, that their abilities are being questioned? Do you have any advice for them how they should thrive in this environment and just don't give up?
Yeah, I think the world has changed a massive amount since I was in high school. I think training for teachers has changed, and the approach that teachers take now has changed a lot. Back then, I'm saying now, I'm making myself sound really, really old. Back then, I don't think there was much as a focus on individuality or trying to encourage those that maybe were struggling a little bit. probably my message to people that are feeling like that would be, don't give up. You definitely have the ability to do it. You just need to find your unique path to do it. And that, I found my unique path as well, as I'm sure we'll
Absolutely.
touch upon. It's all about finding that way that you get to your end goal. And it's not always a straight line. It's never, most often, it's not a straight line. You will have really lows. You will have many, many downs. But if you have that kind of end goal in sight, there is a way to get there. If you have that determination and that resilience and to keep on pushing forward, because that speaks a lot if you have that determination and resilience.
Definitely.
I was going to say, I think one thing that you mentioned about like the education system changing a lot, that is definitely true. And I want to also touch on like you saying towards the beginning that you felt like, you didn't want to use the word intelligence, which is absolutely, you shouldn't, I think. But I think ours, like the way we graded people has completely changed. So like we don't use the similar grading system. We see people as unique individuals and we put them in places where they feel supported because they need a different kind of support. And that's sort of grown over the last, I'd say 20 years, which kind of is just a bit beyond our times. But unfortunately, we're going back again. That's what's happening again. Like, for example, I don't know if you guys know Marta specifically, like a lot of the funding is being cut for supporting people who have maybe a little bit of a different niche, a little bit of a different need. So we should definitely, I think, try to uphold those things because they really do help a lot of people. And maybe Suleman, you wouldn't have had to struggle as much as you did if you were given the right support.
Yeah, I mean, I think there's definitely been changes. Absolutely, there's been changes, but I do agree. Like, I think we've reached a point where we've kind of plateaued a little bit, and funding is just a massive issue these days. And I don't think it's not for the want for educators to help and care and nurture. It's just the resources are just not there anymore. With the vast amount of people that we have, and I mean, example of the success that you can have when you nurture people and you really believe in their true abilities is there's a doctor that has just graduated in the UK. I'm not too sure what her name is, but she is deaf and she's blind.
Wow.
She's on long-term oxygen and she's qualified as a doctor. She's been supported through her special needs that she's got that are unique to her, and she's been supported all the way. Now, she's had further challenges down the line where it's been well documented in the news that she wasn't given priority in the allocation of places to be close to her home and to be close to her her medical team. But the fact that she's managed to get through one of the toughest degrees that you can do out there, being deaf and blind, shows that what you can do with the support when it's there.
It is impressive.
Absolutely.
Yeah. One last thing that I would add to what we were discussing in terms of like doubting your ability is obviously family and the environment matter a lot, but I've noticed, and it affected at least me a lot during my high school and early age. I mean, to be honest, throughout the university as well, when you see some people that obviously will be praising themselves that they spent only night studying for a certain subject or writing an assignment and they still got the best grade, whilst you were, let's say, preparing the assignment for like 2 weeks, you put a lot of effort into it and you either got the same grade or even lower. Yeah. So I think that praising people that haven't slept all night and still made it through the exam, yes, sometimes you need it because I presume that during medical school, this is what a lot of people do. Yeah. But obviously...
I mean, Suleman doesn't sleep at night. He sleeps during the day.
You're letting away all my secrets now.
This is a skill, but we would encourage you to listen to our podcast about sleep, though.
Yeah, we have an episode on sleep and it's important.
Okay, I'll listen to it.
Yeah, but that's why I had like unwritten deal with my friends during my university. Sometimes that like even if somebody got a better grade, you just can't compare one to another. Everybody's just so different. Yeah. And just knowing that the person A got a better grade than me does not mean that you are just less. Again, not using the word intelligent, less like familiar. I mean, well, familiar. Obviously, the grade comes from somewhere, but this does make you a worse person.
Yeah, it doesn't make you less capable.
Yeah, exactly.
I think grades are just a bad way of judging people's abilities.
Absolutely, yeah. Absolutely. I mean, I was told when I was in a college that from my English teacher that I will never speak English well, and she didn't want to send me on a conference because she just laughed at me when I was asking whether I could go for a conference. And obviously, at that point, at the age of 15. I wasn't speaking as well. Obviously, I was making a lot of
Yeah.
mistakes, but at the same time, it's not about that. So it can really have a big impact on you. Just I think facilitating the good skills in your students is just so important.
So again, that's one thing that I've noticed. I didn't see this when I was in, I don't want to put other universities down, but in, let's say, more elite institutions, I found that they had a very sort of set way of assessing students. Whereas, for example, I find in our universities, in all of our degrees, in all of our modules, we have to have multiple ways of assessing students. So like there has to be assessment on practical work. There has to be assessment on like material work, like learning something and doing an exam, for example.
Mm-hmm.
There might be an assessment which might be like a presentation. So that you give the ability to multiple people with multiple different skill sets to score a good grade, because different people are better at different things. And I think that's what we should do.
But your university is quite new, is it? Or relatively new compared to the older
it's a post 92. It's a post 92. Yeah.
So I think that's maybe because a lot of their founding stuff has been based on that as well. Whereas a lot of these other universities, or the Russell Group universities, are all very one focused and can you produce this? Can you do this? Right. Okay. We need to get
some of them are also changing their ways, but I think it's just important that we need to constantly challenge our views and
100%
change them. I think that's what we need to be open to.
Yeah.
So let's talk about your academic journey. So we spoke about your sort of how you got into science. So tell us a little bit about what you did when you came to university. So what's your academic journey? How did you end up? So start from where you began, and how did you end up in medicine?
Oh gosh. So
it's a long process.
I left school in 2005, high school in 2005. And at that point, very scary for everyone who's leaving school. They don't know what they want to do. And I remember always comparing myself to my peers. And Shafkat probably say that's probably still the same. You probably still do that. And I think I do. But I think that's a process of working through that. So in 2005, I'd applied for Biomedical Sciences because I was 16 then. At the age of 16, I thought, it's got medical in the name. I'll do that because I like medical. Not really know much about it or anything like that, because I didn't have the grades to go into medicine.
Oh, so you were interested in doing medicine, but you didn't think you had the grades to.
Yeah, so I mean, I thought at that point, I think ultimately what I'd like to do is medicine. I think I'm quite interested in that, quite fascinated by that, but I just didn't have the grades. So I applied to do Biomedical Sciences, which I got in for, which I had the grades for. And then realised that Biomedical Sciences was not for me. And the university that I went to gave you the choice to decide your final biological degree in second year. So I did modules on anatomy, physiology, microbiology, found myself fascinated by pharmacology. Just the way that you can take a drug and modify the biological system and see the outcomes of that. I thought that was absolutely fascinating. So I set on pharmacology and I loved every moment of it. So I graduated with a pharmacology degree, upper second class with honours, 4-year degree in 2009. And then 2009, I remember sitting on my desktop computer at that point, thinking to myself, it's the summer of 2009. What am I going to do with my life? I've got this degree. What am I going to do? And in all realism, with a bachelor's degree in science, you have to think to yourself, what can I do with that? And at that time, it was either I apply for entry-level jobs in industry or I do further education, because I was being trained to be a scientist. And I was looking at availability and found a degree program, Masters of Research degree program at the University of Glasgow, and integrated mammalian biology. And I thought that was quite fascinating and started that and found myself falling even more in love with immunology at that point, because I was introduced to immunology, and I was looking at the role of the adaptive immune system in atherosclerosis in animal models. And I found it absolutely fascinating. And I graduated with that in 2010. And during...
So that was an MRes?
That was an MRes, yeah. So that's a 1-year degree. And during that time, this is probably the one time where I had validation of my abilities. I we used to have meetings with our supervisors or the head of your program to see how you're getting on, to make sure you weren't struggling and stuff, and you're meeting the targets and you've got enough to write your dissertation, etc., etc. And I met with the head, who is Professor Ian McInnes, and he had actually requested to see me, and I was like, oh my gosh, I'm getting chucked out. What have I done? I've done something wrong.
That's such a you thing to
Yeah,
do.
Oh,
it
no.
totally is. Always doubting myself. And I went and I remember the sentence he said to me, so some people have let me know that you're quite good. And I was just like, who? What? Me? And I genuinely like, what me? He's like, I'd like you to apply for this PhD, have a think about it. And at that point, the word PhD to me was just like, are you serious? Me doing a PhD? That's just not possible. How can that even be a thing? Applied for it, which was the Nuffield Foundation Oliver Bird Rheumatism Program. And the interview process was like, it was multiple round robins. It was really interesting. And it was just an open discussion about how you saw science and how you would modulate a system and how you would design a project or how you design an experiment. And to my surprise, they offered it to me and I was just like, oh my gosh. So I did my 4-year PhD, which I wrote up and then graduated in 2015, I believe. After that, worked for 2 years as a postdoc in an amazing lab looking at HIV and hepatitis C and spontaneous clearance and the immune basis of that in patients across Greater Glasgow and Clyde. And that was fascinating. And it kind of brought back the whole human interaction aspect of science, because here I was sitting in the lab and I was sitting doing experiments, but I was also doing them on patient samples. And I was learning about the patients, I was learning about their symptoms, and I was like, oh my gosh, this flame is kind of reigniting of medicine. And I was getting absolutely fascinated by it. And I was finding myself asking my boss, can I come to clinic with you? Can I just come and sit in and see how it is in clinic? And she's like, absolutely, that's fine, you can come. And it was like a light bulb moment. I was like, oh my gosh, this is where I need to be. I need to be treating patients. I want to be treating patients. I find it absolutely fascinating. So I decided to apply for medicine. And just to say, I'd applied to medicine throughout multiple times as well, and I didn't get in. And I applied to medicine, and I remember I was at the BSI with yourself, Shafkat, in 2017, and I was sitting in a lecture, and I thought it was the University of Dundee at that point, but it was Aberdeen messaging me, and it was an offer for an interview, and I was just like, oh my God, I need to leave this lecture. And I went outside and booked the space straight away. And I remember sitting down with Shafkat that whole lecture, and I probably annoyed him so much because I just kept going on to like, do you think I should go? What should I do? What should I do? And it was just a great feeling. Went to the interview and I got a place for the 2017 entry. But at that time, I felt like I wanted to save money because I was a self-funding student. So I deferred for a year, started in 2018. And then in 2023, I graduated as a medical doctor, did my 2 years foundation program training in Glasgow. And now I am a GP specialty trainee registrar in my first year in Glasgow. I have 2 years left, and that will be me, a consultant GP after that.
Wow. What a long journey.
Yeah, we're going to have to take you back a couple of times to talk about some of the things that you did along the way. But actually, I really like the fact that you summarized it that way, because it's easy to follow that.
Absolutely. Yeah. Wow. I don't even know where to start, but I think so you didn't think like seriously that you would be able to get to, or you said you were applying to medicine before, right? So this idea was with you before.
Yeah, so I had kind of fleeting ideas of there's that medicine thing from school again, should I apply? And it was always kind of in the background. It was mainly between my master's and my PhD where I had this kind of lull and I was like, what do I do in my life? And I applied. I'll apply and see if I get in. And it was just always rejections of just, we've got too many people applying and the competition's really high, this type of stuff. And that was really demoralizing to see that, especially because the GBRC where we did our PhD was right in front of the medical school. And seeing the medical school every day and walking past these students going on in the first day, it was really, really demoralizing to see. But yeah, I'd applied between then as well, and I didn't get in, unfortunately.
Is just the rejection based on the results of the UCAT test? Because I remember that when I had a colleague that also wanted to apply for the medicine, I think there were some entry exams that are pretty tough, I believe. And I think you need to do them first, right? Or
yeah, so I had the educational prerequisite. So I had my upper second class honours degree. So that was educational prerequisite. And I think it just came down to the UCAT score, really. It was trying to play that numbers game. And I mean, there's caveats to the UCAT scoring system.
Yeah. That's another problematic scoring system in my opinion.
Yeah, it really is. I mean, I understand that there's so many people applying for these
Yeah.
courses, and they're prestigious, and you've got to get the right type of people. But that exam, out of all the exams I've done in my whole life, I hated the UCAT the most. It was the most annoying exam to do.
I guess it's also like you can't really prepare for it.
Yeah, exactly. I remember sitting in the lab showing you it, and I'm like, you were doing better in it than me, and I was like, Shafkat, why are you doing better in this?
So can you just tell us briefly about this UCAT test? Because when I spoke in the past with some actually students that wanted to apply for the medicine, they were asking about this test as well. Obviously, I don't have this experience because I just looked at it briefly, so a few questions, and I was like, okay. So what does it entail? What does it include? Do you need to know everything or?
So you don't need to have any knowledge of medicine at all for it. You don't need to have any knowledge of science or anything like that. It is a knowledge based on aptitude and verbal reasoning, mathematics, and abstract reasoning. So you will read passages in a time period and you'll answer questions on it. You will do mathematical formulae and you'll work out the answers for that. And then you will have abstract reasoning, which will be recognizing patterns in different things.
Yeah, that's the one that I could never see anything at all in it. It's like, just guess whichever one it is.
So yeah, that one was quite annoying. But yeah, and then that comes together to give you a score. And then you have a situational judgment test, which is a test where you read a variety of different scenarios based either clinically or not clinically, but you don't need any knowledge of medicine. So it'll be, you're working in a ward and someone comes in shouting at you, how do you deal with that? And then there's various options. Or a nurse comes to you and speaks very harshly to you. What do you do? And it's a very clever test in catching you out because there's always one answer that's very similar. But that is still a prerequisite for you to get an interview in many universities in the UK.
After the UCAT, then was there an interview, or because like I hear some people get past the UCAT but they can't get past the interview. So what was that like?
Yeah, so every university is completely different in the UK, which is another issue. The way that they use their weightings. So, I mean, I can speak most about Aberdeen in that 50% of your application is your educational attainment, and 50% is what was it? 30% is your educational attainment, 20% is your UCAT score, and that comes to give you a score for you getting an interview. So if you score highly on that 50%, that's great. You get an interview, and then 50% is your interview score. Glasgow, I think, uses their
also
UCAT
these
score.
may have changed since then, obviously.
When I was applying, Glasgow had used your UCAT score, so they would just say, do you meet this threshold? If you do not meet this threshold, then you do not get an interview. If you do, then you get an interview. So they all use it very, very differently.
Was the interview hard?
No, the interview wasn't hard because, I mean, I can only speak for Aberdeen. I think you get to a point where it's about you. They want to know about you. And I've got the unique ability or the unique insight now that I've actually interviewed for Aberdeen as well. So I was on the panel interviewing students. And I get to see it from the other side. They want to know about you. They want to see that passion. They want to see why you're interested in medicine. And they want to be able to see how you bring your creativity to medicine. They want you to elaborate on your answers. They want you to just have that open discussion with them. And it genuinely is that's what sells you at the interview.
That's really interesting because I have also sat on some interview panels at other universities for medical entry, and some of them have absolutely nothing to do with you at all. Like,
really,
they literally give you abstract scenarios and see your ability to solve problems, like creative thinking and that kind of stuff.
Oh.
That's very interesting.
So it's I guess it really varies on where you go.
Yeah, it does. I mean, in Aberdeen, at least, it was very, very much based on, and they told you this before you went in. I remember from myself and from interviewing students as well. They tell you that we just want to know about you. That's all we want to do. Is you've got to this point, show us yourself, and yeah, it's just about having a discussion. I mean, they still ask the prerequisite questions of like, professionalism. They cover all the domains of good medical practice, but they ask it in a manner where you're able to show your uniqueness, and they want to see that, at least in Aberdeen.
It's really nice.
So I want to take it even further back. So let's go back to your PhD, because actually our podcast is called Tea with T Cells.
Yeah.
Despite, as you very well know, Suleman, and I have openly said, not a massive fan of T cells. Whereas you actually are a fan of T cells, and actually your PhD was on T cells.
Gosh,
Do you want to tell us a little bit about your actual PhD project? Like, what was the science that you did?
Yeah, so I didn't have a defined project at the beginning. I remember going in with my supervisor, and it was just, we're going to look at this subset of T cells called T follicular helper cells. We don't know what we're going to do, but we just need to do stuff on it. And kind of after many discussions, it got defined to, so my title in my PhD was Dissecting the Role of T follicular helper cells in Experimental Models of Atherosclerosis. And they are a group of T cells that are specifically tasked with producing high affinity isotype switched antibodies to specific targets. So they're very attractive in a variety of different fields in cancer and immunization and chronic diseases like atherosclerosis as well. So I designed animal models where I was trying to determine, one, were they present in a model of atherosclerosis? What was their role? And then what happens when you knock them out? So if you knock them out in a chimeric model, does the atheroma burden go up? Does it go down? Does it stay the exact same? What happens? So yeah, that was about my project, really, was modulating these T cell subsets and seeing the effect that they had on disease burden.
Mm.
And we spent many a year arguing about whether atherosclerosis is that important or not.
Yeah, exactly. As all scientists do. I mean, majority of people will die from it, so I think it's still quite important.
Yeah.
What is your
I did
opinion,
my.
Shafkat?
Well, I mean, the argument that me and Suleman always had was more about, he thought that, I mean, I can be honest here, he thought that my PhD was completely useless because I was
Ooh.
studying I was studying arthritis, and he was like, how many people die from arthritis? Nobody. And I was like, yeah, okay, but it's not just about death. And he was just like, it's all about atherosclerosis.
I think that's probably my underlying kind of want in life coming through there, because I think I was thinking of the human aspect of it, whereas you were thinking about the knowledge, gaining the knowledge and dissecting and learning about the process and the scientific process, whereas I was probably just like, how can we save the world, and how can we, well, you were saving the world in a different way, but I was like, how can we save
but I had never had any interest in saving the world. I just wanted to know about how a specific T cell did this specific thing. That's all I cared about. I didn't even care about atherosclerosis, frankly. But arthritis, I should say.
Actually, I have a scientific question to you both then, because we are exchanging these terms and people probably will get confused, because it is really easy to get confused with arthritis and atherosclerosis.
Yeah.
Do you want to tell the difference? Because obviously it's something
I can
that
talk
people
about
maybe...
arthritis, right? Arthritis is essentially joint inflammation. Actually, you probably know better about this now because you're a doctor, so correct me if I'm wrong.
I'll let you go.
I'm a practitioner because I have it, so...
Yeah, so it's essentially joint inflammation, and it comes in different flavors depending on the type of arthritis you have. I think it would be wrong of me to say that I was studying arthritis, because even though I was funded by Arthritis Research UK and my model was based on arthritis, really what we were interested in understanding was how some specific immune cells come into this arthritis tissues, the signals that bring them in, and then how you can modulate that. So that's we were studying the more fundamental immune side of things. So that's my contribution to arthritis, in quotation marks. Suleman, atherosclerosis?
Yes, atherosclerosis is also an inflammatory disease of medium and large arteries. It's characterized by the accumulation of fat and necrotic cells in the wall of these arteries. Initially, it wasn't seen as an inflammatory condition, and that's only been over the past 15, 20 years that we've seen it as an inflammatory condition. It was just seen as a kind of bland disease of, you eat too much fat, the fat accumulates in your arteries. But we now know that the immune system is massively involved in propelling that process and destabilizing the plaque, causing embolisms, causing strokes and heart attacks as a result.
So we could call it more of a cardiovascular related, obviously.
Yeah, definitely.
Condition. Yeah. schemed for obviously your undergrad or PhD. Here I did PhD and then jumped into medical school.
Yeah.
But obviously what we, I think, all want to know is obviously whether you had any challenges during your PhD. And obviously you said you were always doubting yourself, but were you also doubting yourself when you already were on the PhD? And did you actually enjoy it?
I think if you ask everyone that question about enjoyment, it's a very hard one to answer about a PhD. PhDs, in the sense of that you've created a piece of work and that you have developed knowledge where there was no knowledge, that's extremely satisfying and that's really enjoyable. It's obviously hard. It's really, really hard. It's intense. There's long, long nights. There's a lot on you to justify your findings because in the end of the day, you're creating this knowledge and you have to justify it. You need to know everything in the area. Yeah, Shafkat will know the many professional panic attacks I've had of not knowing about a subset or whatever, or not knowing about a cell. Yeah, I think overall I did enjoy it. I met a lot of good people. I mean, I met Shafkat through it, and I'm really grateful for having Shafkat in my life. I met a lot of good people through it. I had the opportunity to present at national presentations. Yeah, so I think overall I did enjoy it. In terms of challenges, I think my main challenge was I have massive imposter syndrome. So even though looking from the outside, people might think, oh gosh, he's doing quite well, he's developing data and stuff, I always critically analyze it over and over again. And that's something that I still struggle to address quite often. And the challenge is sometimes professional relationships can be a wee bit strained, mainly between student and supervisor. But I think that's natural in all PhDs. Yeah, I think professional relations can be strained at times, but I think that's to be expected, to be honest. And I have an amazing relationship with my supervisor now. He always remembers my birthday for some reason, every single day of my birthday. It's been numerous years. He texts me every day on my birthday to wish me happy birthday. And me and Shafkat both know he's probably got that little diary that he writes everything on with my birthday written in it, which I think is kind of sweet. But we get on quite well. I've learned a lot from him. I learned a lot from my postdocs, from the PhD students around me as well. And it gave me a massive amount of resilience. I think doing a PhD gave me so much resilience that I've translated into my day-to-day life as a doctor now.
I think you've already answered my next question, which was also relating to PhD, because obviously, do you think that you could do without doing a PhD? Do you regret doing it? Because imagine the scenario that you got yourself into medical school before you got into PhD. Do you think that it made you a better doctor right now doing the PhD? Or do you think that it could be, I don't want to use the word waste of time, but it was just one thing that ticked off the box and it was not necessarily needed? What do you think?
Quite a lot. And I think when I was younger, I used to think, oh gosh, I should have taken those 5 years and just applied for medicine and I would have been 5 years younger. But I'm still here and I'm still going. And now the way I view it is I don't see it as a disadvantage at all. The PhD taught me massive amounts of resilience, massive amounts of self-confidence in my own abilities, and just generally a way to carry myself in professional spheres as well.
And probably problem solving.
Yeah, massively. And I've seen it in my ARC-Ps and my revalidations every year. I see it in my consultants commenting on me that you work in a very dynamic process, you problem solve very well, and even just recently I've been told you realise problems are occurring before they even occur and you address them. And I think that's not, oh, I'm just great or whatever, or I'm perfect. I think it's just I've learnt this process throughout the PhD of identify the problem before it becomes a problem. And that translates into medicine really, really well. So no, I think it's been of advantage to me. And it's also opening many, many doors further down the line for me. And I was just looking yesterday, thinking of what will I do after after I complete my training as a GP. And there's a process of becoming an academic GP where you become a senior lecturer at university and you're expected to complete a PhD with that. But I've got the PhD, so I don't need to do those 5 years because I've got the PhD. To become a consultant in surgery or to become a consultant in cardiology or gastroenterology, a lot of them have to do PhDs, but I've already got that. So I don't need to take that time out if I wanted to go down that pathway. So the value of a PhD, even in the medical sphere, is very, 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 very highly thought of. And I think it's only been an advantage to me. I don't see it as a disadvantage anymore.
Yeah, I say this to a lot of our students because they often they often have the similar sort of queries about, well, am I wasting my time doing this? Should I do this? And I often tell them that actually, I find a lot of people tell me that the best doctors they've come across are often doctors that have done other degrees, not necessarily just a science degree or a
Yeah.
PhD, but done other degrees which teach them some other skills in life, because I think it's really, you can apply that to a
Yeah.
lot of different scenarios.
I mean,
Absolutely.
like, in terms of medicine, I mean, I can't remember if Shafkat disagreed with me or not on this, because I think we've had this chat before. I think we should move to a system where you're required to do an additional degree before you do medicine.
So I mean, like the
Mm.
US and Canada.
Yeah, and
Yeah.
I think that system works so much better. Not only just for knowledge, I'm not saying even for knowledge, I'm saying just for general maturity and the ability to have that resilience, because the resilience only comes with time and it only comes with age. And if
Mhm.
there's anyone doubting themselves about the age aspect of it, because that was a big thing for me as well, I was just like, oh gosh, what age am I going to be? You're going to be that age anyway. You may as well do what excites you in that moment in time with an end goal in mind. If medicine is the end goal, but have that pathway and have that end goal towards medicine and work through it, you're going to be that age anyway. And it was that decision I had in 2017 when I was sitting with Shafkat and I got that interview and then I got that offer of, do I do medicine or no, what would I do? Well, I can continue in science. I'm going to be 35. I'm going to be 36. I'm going to be 37. Do what you want to do. Do what makes you
Mm.
happy.
I do really like
Yeah.
that you said that, because that's the way I always think, and I try to say to my friends that also have this like doubts, oh, how old am I gonna be? I'll be like in my mid-30s. But then obviously it's like you will be that age anyway, exactly what you said.
I mean, when I was in medical school, there was maybe 50 graduates in my year, and we were a year of 185.
Really?
Yeah, and we used to take up a whole row of graduates. It's totally underestimated the value that you can bring after having another degree, especially in science. Especially in science. It will help you so much with the knowledge, with the resilience, with the understanding, problem solving. It's not a disadvantage at all. And if you're worried about that, it's because society has programmed us to think about these things, isn't it? And to worry
Yeah.
about things.
Would you say medical school was, I don't know if easier is the word, more approachable because you'd already done a science degree or like even a PhD? Like, did you, because I find that a lot of medical students are hyper fixated on exams. They're terrified. They really struggle with it because obviously it's a very exam based degree, unfortunately. So how did you find it coming from like a scientific?
I felt, obviously exams, I still got panicked at exams. I still do to this day. Get worried about exams, and that's absolutely natural. I think where my experience helped massively was with the clinical aspect of things. So when I had OSCEs, so these structured clinical exams where you had to interview patients and you had to pretend you were the doctor or you had to examine the patients, my ability to communicate and reassure, interact with patients was not to bring down younger people or people that haven't done a degree, but you could see the difference. You could see because I was older and because I'd been through a whole process before, my
You'd done a
approach to it was
Viva.
just, my approach to it was completely different. And I think it helped massively in that sense. When it came to exams, I think Shafkat knows me well. I think whatever exam I do in my whole life, I'll always be like, oh my gosh, I'm doing an exam.
Yeah, but I don't think you're the only one. Most people are like that, you know. So I think
Yeah.
it's really relatable to a lot of people.
Yeah.
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 I guess it would be hard to compare because obviously the PhD was the first one, so I anticipate the answer. However, do you think that PhD or medicine, would any of them be more difficult?
I think that's really hard to answer. They're completely two different entities, I think. The PhD was hard because I was creating everything. I was creating that knowledge, and I had to justify that knowledge by reasoning and by finding things myself and developing my own thought processes. Medicine was hard because there is just the vast amount of knowledge that you need to know. If I went to medical school one day and didn't go home and write up my lecture notes and went the next day, I would have been 2 systems behind. It's intense. There's a lot of knowledge, and I think there probably does need to be reform in medical school in terms of the way that's taught. But they're two different complete entities, and I think they're hard in their own respects, but totally manageable.
Good that you're saying it, because it's for some people, including when I was obviously younger, it seemed like a impossible, like a mountain to climb, like
Yeah.
PhD or medicine. And I think that the society obviously have its own, well, how do you say it? They expect you to do certain things at a certain time. And a lot of my female friends are obviously worried that by the time they reach 30, they should not be studying anymore. They should be at home, like working, having a full-time job, having a family, which obviously makes it more difficult and stressful, I think, for a woman just to have this external pressure as well. Even though some of them perhaps would not like to do that, but there is still this external pressure. So I think that it's just always good to like come out and show that, hey, even at the age of 40, I will be finishing my medical school, or even later. Because it's fine. You don't need to be like turning 30 and that's the end of your education and so on. So
I mean, in our school, we've got a person who's done the reverse, right? He's had a full career in medicine, and now at the age of, I don't know what his age is. Do you know, Marta?
39. I asked him yesterday because I saw him in the lab.
39, yeah. Yes. 39, he's now come in to do a PhD because he just wants to learn about science. So it would be great to have him on board as well. I don't know. If he's interested in doing a podcast. But
I'll ask him. But he has, I think, few kids right now. So I know that he's coming in the morning and then he comes back home to pick up his kids. And then he comes back to the lab again, which I think is the higher level of actually intensity. Because, if you have to manage like your family life in this way, you just need to be so well organized. And I think that's the key. It is not impossible, I guess, but you just need to be so well organized. And I think that's something that you have to have regardless if you do PhD or medicine, because it's just very challenging, isn't it? Yeah.
Okay, I want to now jump a little bit forward. And
to medicine.
You said a lot of nice things about academia, about, being a doctor, medical training. Maybe we need to also hear about some of the not so nice things, right? Because I find particularly in our student cohort that they have a very warped view of what life as a doctor is like. Mm-hmm. And I try to give them a very realistic view of what life as a scientist is like. It can be horrible. It's a really challenging career. It's really competitive. Like, I don't know, 1 in 40 make it into an academic post at a university, which is just incredibly small numbers. So you're now a GP trainee. You've worked in the NHS for 2 to 3 years, maybe a little bit longer. So that's a little bit about what things are like in the NHS, what your working day is like, some of the challenges you face.
Yeah, so right now I'm on a psychiatry rotation because as a GP trainee, you have to rotate through specific specialties. And psychiatry in itself is challenging because you're dealing with individuals that are suffering in a manner that does not physically manifest. And I think as doctors, we're all very programmed to be like, oh, they've got a broken arm. Let's fix the broken arm. Or they have got internal bleeding. Let's do an operation. And I think a lot of time unfortunately, in our health system, mental health hasn't always been given the same priority. So you see a lot of people at their worst, but it's also really, really rewarding to see what you can do for those people, to see and help them, and to live the best life that they're able to live as possible. Right now, my working pattern in terms of the day job is pretty settled. I'm pretty 9 to 5, because of just the rotation I'm on. But as well as the 9 to 5, I also have very long days as well. So I've just finished 4 12-hour shifts in a row, where I'm the only doctor on duty covering a variety of different wards. So I will get bleeped, come and see patients, and these patients can be really, really ill and they need assessed. They either need detained or they need treated, or their care needs escalated to the tertiary care hospital. And being that one person caring for all those patients is quite a big thing on your head, because you want to do the best by all those patients. You have to risk stratify. Do I go to the patient that's getting chest pain but doesn't sound like they're having a heart attack? Or do I go to the patient that is having an asthma attack? Who do you go to first? And you're the only one person. So it's a lot on your head. And my other rotations, so in foundation year 1 and 2, I'll take you back a year or 2, they were very intense. So they're extremely intense. I would work sometimes 13, 14-hour shifts because there wasn't cover, or there wasn't staff, or you couldn't get away on time because you were 5 minutes before you're ending, someone was coughing up blood and someone was having a variceal bleed and you'd need to go and see them, or you got called to assist in surgery for an emergency surgery that would take another 6 hours that you just can't leave. You'd always have to do the night shifts as well, and they'd be 12-hour night shifts, and again, they'd be very intense, constantly getting called to see patients that are really, really unwell. You don't always have senior support there. You don't always have someone to call, so you're always looking back to reassure yourself that you're doing the right thing. And I mean, medical school teaches you a process of learning how to do this and how to risk stratify, and you do it appropriately, but it's still scary as a human. And I'm telling you, registrars still get scared. Consultants still get scared. We're all human. I think going back a little bit more to the first time I ever entered a hospital as a doctor was I was meant to be doing a day shift, but I got called by the rota manager, and this is my first day, to say, we got everything mixed up. I'm sorry. You're actually meant to be on a night shift. Can you come in? I was like, oh gosh, okay. I didn't prep myself for this, but that's fine. I'll come in. So I went in and I was on acute receiving on a general surgical ward covering the south of Glasgow, which is quite a big area. There was no senior support. The registrars were in the surgery. I was by myself. There's admissions coming in. I was more or less clueless as a fresh off-the-shelf doctor, treating these patients, and you just do the best that you can, working in the protocols that you've been given to make sure that you can do the best that you can. It's scary. It still is scary, but you've been taught appropriately, and you know how to risk stratify that. And that was the only day ever in my life as a doctor that I've come home and I've cried. And I remember going to my mum like,
So
oh my
far.
God, I can't do this. Yeah, so far. I can't do this. This is crazy. But it got better. It got better. And
Yeah.
it does get better. It's not all doom and gloom.
Yeah, of course.
Wow.
Yeah.
So you think that medical school didn't, like, I don't want to use the word didn't prepare you for this, but did you have during your medical school like cases that obviously you would go to hospital and you would still practice?
Yeah.
I guess you did.
Yeah, so in Aberdeen at least you see patients from the very first semester. So you're over at the hospitals examining patients, but you're examining patients that are sitting in bed that have got a bit of a cough or have got a bit of a sore stomach. You're not going to the major bleeds. You're not going to the major heart attacks. You're not doing CPR.
I
And
still
gosh,
remember when you had to do your first CPR and you called me afterwards.
yeah, it was, or my first death certification. Gosh, it was scary. Yeah, these things medical school cannot prepare you for at all. No matter how much they try medical school, no medical school can prepare you for that. They can't prepare you for the intensity of the job. They can't prepare you for all the, the unreliable things that are going to happen, the things that you just don't know. They can't prepare you for that. This is why you have the postgraduate training. This is why you're supervised appropriately and you're go through a process of getting competencies and getting signed off. But yeah, some scary parts, but still enjoyable.
So it can't prepare you for that, but obviously based on what you already said, that it was so intense during the medical school that you literally had to like do the notes every day and to
Yeah.
always be on the top. In some ways, it gives you a bit of a flavor of what's coming next because you will
Yeah.
have to work a lot.
Yeah, I mean, Aberdeen was good, and I'm keeping coming back to Aberdeen because that's all I know. Aberdeen was good in the sense that they had a award that they mocked up as a award, and I still remember it. And I probably phoned Jay Shafka after it, thinking, "Oh my gosh, what the hell is going on here?" And that was a one day of medical school that is actually really similar to the way it is in medicine. And I remember going in, and they were telling us, "You're right. You're the doctor on the ward, and." In all these cubicles, there's patients, and we are your nurses, and on you go. And it was just like, oh gosh. And they started the timer, and I remember going in to review a patient who had abdominal pain, and I was examining her. I was like, okay, I'll get you some pain relief. And then the nurse came and pulled me. She's like, doctor, you need to come and see this patient right now. And I was like, oh, right, okay. As a medical student, I was like, oh gosh, I wasn't expecting this. Right, what do? I had to quickly go and see that other patient, whereas the other patient was sitting screaming with pain in her stomach. And then on top of that, as I was trying to get contact from my senior, they had pretend phones and stuff. I had a delirious patient that was coming up to me and she was hitting me with her catheter, and they were acting this all out. But she was hitting me with her catheter bag, and I was just like, oh my gosh. But it's actually all very realistic. You get a lot of these challenges in wards, and it was an eye opener. But I think I've got to the point where I'm able to manage it all quite well now.
So I have a question. So how do you keep yourself sane after all of that? Because
Yeah.
it is challenging to
Yeah.
say at least.
I think it's all about having a good support network around you. So my mom is an amazing support network. Shafkat is an amazing support network. Like I will phone Shafkat multiple times a day and just debrief on things. And he just listens, and that's all you need is someone to listen and to be able to debrief with you. And sometimes give you a little bit of validation because I'll be like, Shafkat, was I right in this? And he'll be like, yeah, you were right. But also Shafkat will tell me when I'm wrong as well, sometimes to my much dismay. So yeah, it's all about having that support network around you. There's support networks at the hospital as well. You're mentored by consultants. You have support there to go to if you're struggling. And being able to speak up for yourself and to be a spokesperson for yourself as well. To realize when you're struggling, that's really important in medicine, is to realize if you're struggling, speak up. No one's going to say to you that you're a less of a doctor than everyone else. You're human at the end of the day. You're treating patients, then why wouldn't you recognize things in yourself?
But I think it's also important to say that actually it is very common amongst doctors to have or to go through periods of suffering from significant mental health problems that they need to seek support for. And it's because of that toll that you have, like you're only a human. You're as human as anybody else.
Exactly.
And when you put that amount of sort of stress, pressure on someone, it obviously takes its toll.
I think still society and patients have the view of when they see a doctor of you're seeing a superhuman person. Oh my gosh, this person's amazingly intelligent and they're superhuman, but they're not. They've got the same fears as you. They've got the same worries as you. They're questioning if they're doing the right thing. And everyone's got mental health, and mental health can deteriorate just as much as in a doctor as it can deteriorate in a patient.
It's not even more in some ways, because obviously you're handling very stressful sometimes job. Like being responsible for human life is something that, to be honest, puts a lot of people off the medicine, especially like, to be honest, all doctor, like all different wards. But I think obviously surgeons and like anything A&E, like your one decision can be a game changer for a better or for a worse. So it is no surprise that, medical doctors may suffer even more with their mental health issues.
I think a lot of new doctors go into medicine with the viewpoint of, I want to help everyone and I want to make sure all my patients are great and I'm going to repair everyone. And that's just not the realities of life. That's just not how medicine works. I think it's important to recognise that sometimes being kind to someone and doing the best for someone is to step back and say, have I done as much as I can here? Have I helped this person to the point where if moving forward we cause them more suffering, and am I doing it in a safe, legal and ethical manner? And I think you should always ask yourself those questions. And sometimes the kindest thing that you can do as a doctor is just to sit down next to that person in the bed and hold their hand. And I've done that to so many patients, and I don't discriminate in any sense whatsoever. I've done it with big, burly, tattooed men. I've sat down and said to them, look, I know you're struggling, but I'm speaking to you as a human being. And I'm here to help you, and I'm going to do my best as I can help you, because everyone at the end of the day has feelings and everyone has emotions. And if you can connect with that, sometimes the biggest impact you can have is having that human impact on a patient, not what you can do with a scalpel or what you can do with a medicine. It's that human impact.
I'm glad that you're saying it, because I read a book about obviously doctors, and like doctors are often, well, especially nowadays, like you come in, you have a patient, and sometimes the first thing you should ask is, how are you doing? How are you feeling? And lots of doctors obviously forget about doing it, and we can never blame them because you work in such a like stressful environment. But patients essentially value that so much that sometimes this conversation and how are you feeling about that?
Exactly. I mean, like to this day, like medical schools make a massive emphasis about it. And even as you practice as a doctor now, you're taught an acronym called ICE, which you should incorporate into all of your consultations, which is ideas, concerns, and expectations. So you ask your patient, what are your ideas? What do you think's going on here? And I always frame it in, I'm a doctor, but you know your body best. What's your idea? What do you think's going on here? And they'll tell you, like, well, I was actually reading up on this, and I think I might have asthma or I might have eczema. And then you ask them about, well, what's worrying you about that? What's your concern? And sometimes patients feel there's a block. They don't want to say to their doctor, oh gosh, I'm really worried that is this cancer? I'm worried about that. But if you ask it openly, and then their expectations, in a consultation of like so you've come to see me, that's the biggest step you've taken. What were you expecting to take away from this consultation? And most of the time, if you ask them directly, the patients will say to you, well, thank you for asking that. This is what I actually wanted. And sometimes there can be a professional disagreement and you think, oh, that's not the correct way of going down it. But having that open discussion with your patient only builds rapport and communication with them.
So is it something that you mentioned it's already incorporated in the medical
Yeah.
training?
It's part of a medical history. So ICE, ideas, concerns and expectations, and it should be part of every consultation. And you'll lose points for it in your exams when medical school if you don't
I remember
it.
when I was examining OSCEs, if they didn't do it, you docked them points.
Yeah.
So.
And even for students, if students are listening to this podcast that are going to apply for medicine, it's an amazing thing to bring up in interviews. They'll absolutely love it because at the end of the day, you're trying to bring that back modern medicine away from this dictatorship of I tell you what to do and you take this medicine and you do this. It's a partnership and you're trying to get that trust from patients. And it's an amazing feeling when a patient comes back and asks for an appointment with you because they felt they've built up a rapport with you. And that's happened with me on many occasions. And I still, to this day, I doubt myself, like, oh gosh, why are they asking for an appointment with me again? But you build that trust with them and you build that rapport. And that's what's enduring for them. They see you as that doctor that actually listened to them. And they're more likely then to listen to you of what your professional opinion is.
I absolutely love that it's already incorporated and it is definitely a game changer. Absolutely.
Yeah, definitely.
Yeah, we've definitely been moving in the right direction for the last, I think, 10, 15 years in just, I think, education in general, whether that's medical education, science education, whatever. I just hope we keep carrying on in this path of trying to make these careers and degrees and what the service you provide at the end more human, Because I think we spend the longest time for them just being like, I don't know, a machine, like you're just delivering something, which obviously it isn't,
Yeah, absolutely. Yeah.
I think in any mentorship, because I can see a big difference coming obviously from a different country, that at the university in my home country, you are just a number. And we don't have in my country things like, I think it's called personal academic tutor, is in the UK here. And there is like it just brings so much good to you when you actually have somebody to sit with, even if it's just for a short time, and you just discuss your concerns, what is going well, and it's just something that I wish.
I didn't have it in my degree. I don't know if you had it, Suleman. That sort of individual academic who mentors you throughout your entire degree. Didn't really have it.
No, I don't think I did in my early degrees.
Yeah. This is a new thing. This is a new thing.
But it's a good thing, I think. I know that it obviously takes more time and I can see how busy academia is, but to all the academics, it is actually sometimes a game changer for students. Unless my experience with it is that I came to the UK and my academic tutor was Welsh. So whenever he was talking to me, I had no idea what he was saying.
Well, my supervisor was Italian, so trying to understand Italian was difficult.
Yeah, it was just like, I just remember when English people were asking me during the lecture, like, what did he say? And I was just like, you are asking the wrong person. I have even less of an idea what he's saying. Such a accent. Now it would be easy to understand, but for a foreigner that came for the first time to study and learned English from the books and, standard English you learn abroad, it's just pretty hard.
Yeah.
But yeah.
I feel like we've kind of covered almost everything that we want to talk about in a roundabout way, as we always do. Let's do some closing reflections. So let's talk about the next 5 to 10 years, Suleman.
Okay.
Where do you see yourself? Where does this career go for students who might be listening to this? So if they finish their medical training in 10 years' time, where do they see themselves? What's their career like? That kind of stuff.
So in a sense, your career is really dictated by the path that you decide to go down and the specialty that you choose, at least for the 10 years after you graduate. With GP, it's a little bit different in that GP training is one of the shortest training programs that you have, if not the shortest. It's a 3-year training program after your foundation year 2 training. So after 3 years, you're a consultant GP and you can go and work as a GP. You can open your own practice or you can decide how many days you want to work as a GP with specialties like cardiology, gastroenterology, that type of stuff. Surgery, there's 10 years worth of training. after that.
Wow.
So it can take a long...
But that training is basically like you're working to learn.
Yeah, of
right?
course.
It's not
Yeah,
like,
so you're working as a doctor, you're getting paid, but you're not a consultant until you complete your training. And for me, that just wasn't what I wanted to do. I wanted to be able to, one, be in the community. That's why GP suited me really well, and work with patients in partnership really well. GP suited me really well. Was very, very fascinated by mental health. So psychiatry had a bit too much mental health for me. GP had enough mental health. So that's why I chose that. And sense where I see myself in the next 10 years is hopefully completing my training soon.
Pass your exams.
Yes, my exams, gosh, they're coming up soon. Then to hopefully be a partner in a practice, and then gradually cut down my time. Now, it sounds really weird because I feel like I'm coming full circle. Cut down my time as a doctor in a practice and move into becoming more of an academic again, and in the sense of becoming a senior lecturer, hopefully. Either medicine or medical clinical researchy type lab. So I get the best of both worlds that I wanted as that little 10-year-old boy playing in the garden dissecting my fishes. I wanted to be that scientist and I wanted to be that doctor. And I feel like I finally got to the point where I can marry both of them together and create a career around it where I'm really satisfied and it's really diverse.
Wow.
Sounds fantastic.
This sounds like when you were talking about this little boy, I can see this little boy right now. And if you told him at that point, you were talking to your younger self, he would be so proud, honestly.
Yeah,
And
I think it would. Yeah, genuinely. It's weird to think about that because I can visualize myself in my garden, my old house garden, just playing there and just thinking of what I've achieved so far all to this point. It's all been because of, one, my mum's belief in me, but also my dedication and resilience of just keeping going and not listening to people that put you down, not listening to people that doubt you, doing what you feel is right and carving that path, that unique path. My path was not straight at all. It was up and down, left and right, back and forth, and surrounding yourself with the people that nurture you and protect you in that manner. And you can do anything you want to do. I mean, I know we've not touched upon it, but access to medicine is no longer an elite access. You don't need to come from a background of my mum was a doctor, my dad was a doctor, my auntie, uncle, grandpa, all this type of stuff. I mean, I was the first person ever to go to university in my whole extended family, the first person to get 4 degrees in my whole extended family, and the first person to do a PhD.
You made up for all of them.
Do medicine, and the first doctor. But there's access to medicine courses. There is so many ways to get into medicine. If you're from what they refer to as deprived backgrounds or a socially, economically deprived background, there's different standards for you to get in. So they're making it much more accessible, which is great, which is really, really good, because I 100% guarantee you those people that are from those backgrounds have a wealth of information, a wealth of knowledge, a wealth of experience to add to medicine that you can't get from people that come from elite backgrounds, that people have come from a whole lineage of doctors.
Yeah.
It is really inspirational. That's for certain. And I think following on that, if you were talking to a student right now, where would you recommend them starting? Let's say they finish their undergrad degree and they are just thinking of going into medicine. What would you recommend them, actually? Would you recommend them PhD, master, or trying to apply?
I think they need to feel in themselves where they want to be. For me, it was, I'm fascinated by science and I want to go down that science route, and medicine is kind of there as well. I want to do that. If they feel comfortable and they want to continue to apply for medicine, keep on going for it. But keep on working on yourself. That doesn't mean you have to always work academically. Keep on pushing yourself forward. Go to those work experience places. If you're fascinated about science, if you're interested in science, you have that curiosity and you think that you could do well in a PhD, absolutely apply for a PhD. And at the end of the day, you're always going to be that age. Don't let age be a thing. You're always going to be in your 30s, 40s, 50s, and whatever. I know someone from TikTok who is in America, and she was 54 when she started medicine.
Is it the Jenny, the Road to Doctor?
Yeah.
Yes. Yeah. I found her online as well, and I follow her. Not that I use like social media much nowadays, but whenever I see her, I'm just so much respect towards her. I love what she's doing.
Absolutely. I mean, happiness and being content in life is comes from what you create. If you want to do a PhD and you find yourself drawn to that, absolutely do it. If you feel further down the line you want to change your career path, not even to medicine, do it. Do what you feel is happy. You've got that PhD. That PhD is always going to be in your bag.
I think that's a really important message. I think a lot of students feel like their life is very linear. And I know I'm very privileged because I've had a very linear career, and I speak about that in one of the podcast episodes. But everyone should always explore whatever they're interested in. And that could be in many different...
End of the day, we're all living life for the first time. And if you don't know something, go and explore it. The worst thing I've always said to myself, and I always said to myself when I started medicine, my PhD, everything, was I just don't want to have regrets. And I can actually look back and say to myself, I don't have a regret because I did everything that I set out to do. I did it in my own way. I did it in my own convoluted path. The first thing I would want to have is if I was 50-year-old and I had sitting in my chair, I'm saying 50 is really old, I'm sitting in my chair and I think to myself, what if I went and did medicine? What if I went and did a PhD? But that time's gone now.
Yeah, absolutely. You leave only
the
once.
only thing that you haven't done, actually, and I was just listening to the plane going past, is you really should have gotten for that flight school, because Suleman loves flying, so he would have loved to have done that as well.
Yeah, absolutely.
Oh, really?
Well, that's happening in the next 2 or 3 years. It's fine.
We'll have you back as what happens as an alternative career path to medicine into being a captain of an airplane.
No, a flying hospital. That's what I do.
But this is apparently it is quite clear. It's quite demanding. They have very big restrictions on who can actually go into
I wouldn't
school.
Get into it. My eyesight is terrible and I've torn my retina. So yeah, I'd be the worst candidate for it.
You can always be a flight attendant.
No. Yeah. We'll see. I think I'll just happy just sitting getting served in the plane nice meals, so that's fine.
We've been going for a while. I think it's time for us to stop. Anything else? Do you have any questions for us?
No, I don't think so. I think just a message for your students is if you are fascinated by something, be it whatever, it doesn't have to be medicine and science, go for it, do it. You will find your path. You will get rejected. 100% there will be rejection in your life, but that is life. And the way that you recover from that is by working on yourself and building on yourself.
I think that was one of the questions we haven't asked. How do you deal with rejection? But you just actually said, work on yourself. Yeah. And I think stay curious in the end, because
absolutely.
I would call it a trade, but it's something that comes back in this podcast quite often, just to be curious.
And always kind of go back to what that child wanted. Everyone's been a child. What did that kid want when they were younger? Because that's always the dreams that we carry on. Like, I'm sure Shafkat was thinking about immune cells when he was 5 or NK cells or something like that.
Weirdly, what really got me into science, I think I said this in my episode of the podcast actually, what really got me into science was space.
Yeah.
Oh, really?
I was more of I was more of a space, that's what really fascinated me, but hey. Anyway, that's that.
Yeah. Okay, wonderful.
Right. Excellent.
Thank you
very
so much.
That was
it's okay. Thanks for having me on.